diagnostic criteria and also some data on treatment. So the key elements of vascular dementia diagnosis seem to be very simple. We need to have, or we have on one side, ischemic brain damage that might be diagnosed based on clinical signs or imaging. And on the other hand, we have dementia. The problem here is right there where the arrow is, how to establish a causal relationship between the ischemic brain damage and the dementia syndrome a patient shows up with. So there are, as you know, these criteria that have been used for a very long time, like Kaczynski's criteria, DSM-4, ICD-10. If we look how they diagnose dementia, we for sure have the focal signs and symptoms. We have dementia, but none of those criteria actually tells the investigator how to establish the causal relationship. They rather leave the decision to the investigator or the clinician, which certainly leads to larger variability in diagnosis making, and they do not include the requirement of imaging. So in the early 1990s, there have been a couple, or actually two sets of criteria have been established. The NINDS-IRID criteria that were quite conservative. Here we have the focal signs, the dementia, we have the temporal relationship with a relationship of 3 months between